Thank you. Good morning. I didn't hear anybody. Good morning.
Good morning.
Are you guys excited to be here? I've been there. This is the first time after I was in your guys' ages that I have younger audience. As you guys see, I'm a registered nurse, and normally I'm speaking in front of professionals, but I love to be here. I'm very excited to be part of this group today and to be speaking to you guys about nursing. I want this to be an interactive conference, presentation, that you guys tell me about yourselves, that I tell you guys a little bit more about me, so we get to know each other and we really make this more interactive so we all wake up, right? Okay, perfect. So as I go through the presentation, I'll be talking about myself. I'll be asking you guys questions, and I want you guys to be engaged, not looking at your phone. I'll be looking at the timer here because we have to be respectful of everybody's time. So let's get started. Are you guys ready? Okay, perfect. We're gonna have fun, trust me. I really, really promise you, by the end of today, everybody wants to be a nurse, right? Okay, let me ask you guys, who wants to be a nurse? Raise your hand. Who wants to be a nurse? All right, so the content that we're going to go through is how to become a nurse. Does anybody know how to do that? No, that's why we're here, right? Okay, so we're gonna go through my career journey so you guys get to know how I got there, who I am, and how I got to be speaking to all of you here today. And then the role of the obstetric nurse. Have you guys ever heard that term before? No. Somebody has. Okay, I'll be asking you some questions later, and then understanding what high-risk pregnancies are. Have you guys ever heard of that term too? High-risk pregnancy. Yeah. Okay, some people say yes. Okay, we can go to the next slide. Okay, so as you guys see there, I mean, it's a little dark, but the second person on the top, that's me. Can you guys tell? Well, that was me when I was younger. I don't want to say my age, right? But that was my first nursing clinical, about maybe 13 years ago. Yeah, don't start calculating my age, okay? So that was me, because everything in life, it starts with what? What do we need when we want to start a project? An idea. Everything in life starts with an idea. And after the idea, what else do we need? Yes, but we also need the why, right? We want to have purpose in life, and that's always the idea behind why we're doing things. So as I said, we want to be interactive, so we need ideas, we need purpose or goals, right? So when I was a child, I used to always play and be the role of a medical professional. And, I kept going back and forth of what I wanted to be in life, and I wanted to say I wanted to be a doctor. And that's all I said until I got to college, and I was like, oh, I learned about nursing, and I realized that what I always really wanted to be was a nurse and not a doctor. And the reason why is, has anybody here been in the hospital as an inpatient? How often do you see your doctor? Like once a day, right? How often do you see the nurse? All the time, right? And that's what I wanted to do. I wanted to be with the patient there all the time. I wanted to give them who I was, and I wanted to help them through that illness and also recovery phase. So that's how I changed my decision, and I said, I don't want to be a doctor, I want to be a nurse. So we will go through the program and we will get through it. So we can go to the next slide. So how to become a nurse. So that's my first question now. I went through the idea of I want to be a nurse, and now I went through how to become a nurse. What do you guys think is the first step to become a nurse? Anybody? Raise your hand. What's the first step to become a nurse? Anybody? Go ahead.
They graduate from high school?
Correct. You have to be a high school graduate. And then I know you guys are going through it. As you're going through your high school program, what classes do you have to enroll in? Yeah, science, right? Because nursing is a science. So you have to take some medical classes, primarily math, biology, chemistry. I know some people are like, oh my God, I don't want to do that. It's very fun when you have what? The purpose. Okay, so we can go to the next slide. So how to achieve a nursing degree. So you have to complete your high school courses, and you have to do some science and math. Doesn't that sound so interesting? I don't see anybody who likes science and math. Okay, I get 2, 3. How about my nurses over there? Okay, they're thinking about it. Okay, and then after that you have to enroll in a nursing program, and we will go through the different programs that we have, and you have to earn your nursing degree. But it doesn't just end there. To practice, you need to have a nursing license, and to get a nursing license, you have to go through an examination called the NCLEX. Okay, don't worry about that for those who want to be a nurse, because your whole entire careers will prepare you for that, to take that test. And 99% of us, we pass, okay? And then once you pass, guess what? You have an RN license, and it's the most exciting time of your life because you're finally a nurse, okay? And then after that, you have to apply for a job like we all do, right? Fun. So once you get to apply for a job, you get to choose where you want to work on, okay? You want to work in the operating room, you want to work in the OR, do you want to work with movement and children? Like, you get to pick. It's like, do you want to be in the ICU? So as you're choosing your job, you can find whatever you want to go. And another fun fact about me, now I'm a nurse manager. Yes, nobody likes the managers, but I get to see your resume and give you an opportunity to work in the area that you want to work in, okay? And then after that, you will get some clinical experience. As you start working as a nurse, you're finally doing things with patients, and you create a whole team with the doctors, with everybody, and then you can become certified on the specialty that you like. The best thing in nursing is, like, you can get to do whatever you want to be, because there are so many things that you can do in nursing, and we will go through that, okay? And then after that, you can do some continuing education, and we'll go through those roles. Is that clear enough, everybody?
Yes.
Are you guys falling asleep? No? Okay. All right, let's go to the next slide. Okay, so these are all the nursing degrees, okay? So to be a nurse, you don't have to go to school for so many years if you don't want to. That's only if you want to, okay? So the first entry level into nursing is called an LPN. It's a licensed vocational practical nurse. LPNs primarily work in nursing homes. They can work in doctor's office, and they are about like a year program. So, and you're called a nurse, you still have to pass the NCLEX, you still have to take a test, but you will be a nurse. Okay, there are some limitations of being an LPN, but we're not here to talk about that. But you still get to practice, care for your patients, educate your patients, give medication, and do so many things. Then the second level of nursing is called an ADN, which is an associate's degree in nursing. I'm assuming you guys are going to high school, you know what an associate is, right? Okay, so the associate's degree in nursing is typically 2 years. It will prepare you again for your RN licensure, which is your test called the NCLEX, okay? And these nurses are way more independent than an LPN, and then you can continue to pursue your career and go to a bachelor's of science in nursing, which is what the degree I hold. So it is a 4-year program that spans your leadership and your research. Who likes research? Okay, I love it, because let me tell you something. I picked to do a BSN. I hated research. It's not something I wanted to be doing. When I was doing my nursing research, I was like, who wants to be this person? Well, later on in life, you guys find out through my presentation that all the things that I said I was not gonna do, I ended up doing, okay? So then MSN is your Master of Science in Nursing. So have you ever heard of a nurse practitioner? Okay, have you ever heard of a nurse educator? No? Okay, well, they are the ones who provide all the education to the nurses that work in the hospital, because we never stop learning in life, right? Do we know it all? No, and we never stop learning. So for the nurses who are in the hospital, we provide them training too and education, because this is a career-long education. We learn every day, and there are things that we have never seen. There's so much innovation in technology that we get every day to the hospital, and guess what? We need to learn. So they are the ones who do that. So to do that, you have to be a master's prepared nurse. And I'm currently enrolled in a nurse practitioner program, and we will talk about that a little bit more. And then you have your highest degree in nursing, which is a DNP, which is a Doctor of Nursing. And then you also have a PhD in nursing, which is doing more focus on research and academic careers. So those are all the careers you can go. You can take any path you want, and you can end in a DNP, regardless of where you start. Is what did I say? What you have to have in life? Purpose, right? So if you have purpose and goal, you can get there. So now you guys will say, well, yes, it sounds interesting, but where would I work? Does nurses always work in hospitals? No? Do you guys have a school nurse? Okay, so as you see, nurses can work in many fields. So that's why I said, for those who never thought they could be a nurse, trust me, you can be a nurse and they do so many other fun things and take care of patients. So you can work in hospitals. So you can be a labor and delivery nurse, okay? You can be an emergency department nurse. You can work in the ICU. If you love children, you can work, you can do pediatrics. We can do oncology, surgery, cardiology, and all the specialties you can ever think of. You can do community like schools, right? You guys said you have a school nurse. You can do public health, where you will be helping the community of people that have diseases. And then you can do home care. You can go to people's houses and take care of them in their house setting. You can work in a clinic. And then there are specialized roles like a flight nurse. Isn't that so fun? Did you guys ever know that we can do that? No, right? So flight nurses, do you guys know, does anybody know what a flight nurse is? Okay, so a flight nurse, I was driving through and I saw a helicopter from Orlando Health. So a flight nurse will be that nurse that gets to go into that helicopter or airplane to get patients from one hospital to the other, or from overseas to the United States. Okay, so you provide medical care while you're on the plane. So that's what a flight nurse does. Forensic nursing, as those nurses do collect evidence for crime scenes. Then you can have an army nurse. Army nurses don't have to be army people. They can be nurses who decide to take some army training and they work in the army hospitals, army workforce, what's the other one? Marines or the Air Force, okay? Then you can be a neonatal nurse, taking care of the tiniest babies. You can be a nurse educator, as I said. You can be a nurse manager, okay? You can do some research. You can be a nurse informatics. Who loves technology here? Okay. Does everybody have a phone? Okay, so why is not everybody raising their hand? I thought you guys like technology. Yes, you do? If you have a phone, if you have an iPad, do you like AI? Do you use ChatGPT? You guys do? Okay. What else do you guys use? There are so many. Copilot, all of that. So we can be nursing informatics. So nursing informatics as those nurses who specialize on not only medical, but they can do AI. They can help the hospital build the computer systems in terms of AI so that nurses can function better. And we can talk a little bit about that later. You can be a legal nurse consultant. What do you guys think that is? Anybody? Legal?
It's like a lawyer.
So they work directly with lawyers, correct? And what they do is, does everything always go well in medical fields?
No.
Are we perfect?
Oh, so if something goes bad.
So when there are bad outcomes and families decide to do, to pursue with, to proceed with lawsuit, the legal nurse consultant will be that person who works with the lawyer and retrieves all the medical records, and they go and look at everything, and they have to be experienced nurses because they need to know all their policies and procedures, and they will be identifying that gap that led to that bad outcome. Okay? And then you can be a case manager who they are very fun also because they are the person who transition the patients from the inpatient, meaning hospital, to the outpatient. So as you're recovering, they will be setting up your appointments. They will be setting up if you need home care nursing, a nurse to go to your house or to your grandma's house or to your mom's house. If the patients need any medical equipment at home, they are the ones that do that. So many more opportunities. They're not just that. As a nurse, you can do anything you can possibly think. But these are some of the ones that I felt were important. We can go to the next slide. All right. So let's talk about me. What did I say that I ended up doing? Everything that I said that I was not going to do, I ended up doing, correct? Didn't I say that? Okay. So I'm a BSN prepared nursing, and then I started working. I always wanted to work in obstetrics. Obstetrics means the pregnant person and the one that has recently delivered, right? Including their babies. So I always wanted to work in labor and delivery, but as I was starting my nursing journey, there were no positions in labor and delivery. So the person that was going to hire me said, well, we have nothing for you, but we have a high-risk antepartum unit. Does anybody know what that is? I didn't know either because I was just fresh off orientation, and I was like, I don't know what that is. And she said, well, that's where we have the moms who are having high-risk pregnancies. They're not healthy. They're not healthy pregnancies, right? Because the normal thing is like somebody's pregnant, they have a baby, and that's fine. But no, they need hospital care. So this is where these patients go. Would you want to do that? And I said, absolutely. So I then became electronic fetal monitoring certified. Has anybody ever had like a heart monitor on them where you can see like your heart rate in the screen? Yes, you guys have? So basically we do that for babies. And the reason why we do that is because babies need to be monitored, and that strip that we see on the screen tell us how the baby's doing. So I became certified into that. And then as I became certified, I started working, and I worked in that unit for 3 years, and I fell in love with this specialty. Okay, a little bit later after that, I moved to a hospital and I started working in labor and delivery. But high-risk antepartum and labor and delivery are almost the same. The only thing that I was not doing was delivering the baby. So eventually I ended up delivering the baby, and then I did not decide. There are things in life that sometimes chooses you, right? And that's why I always say, I ended up doing things I never thought I was gonna do. And I was offered a nurse manager position, and I was like, no, who wants to be somebody else's supervisor, right? That seems boring, don't you guys think? You're like, no, I don't wanna be that person. The person that everybody hates, right? Who works here? Anybody from here works? Do you guys have a job yet? Do you love your supervisor? No, right? Well, so then I decided that I was gonna give myself that opportunity. And guess what I learned? That nurse managers just don't supervise patients and families and nurses, that we also do quality improvement, all right? So When you guys go to a restaurant and you don't like the food, what do you guys do?
Ask for it again or get a refund.
You ask for somebody. What else do you guys do? What?
Ask for it again to do it right or ask for it.
Correct. And do you guys complain? That's called a complaint, right? So every time there is a complaint, what do you think the restaurant does?
Write it down. Write it down.
Yeah, they write it down. But what do you think they do after to make it better? They look at their processes to see why we got there and we did it wrong. So then we decide to do it better. So that's basically what I do. As a nurse manager, not only I manage the nurses, do schedules and so on and so forth, and that's the boring part. But the very cool thing about my position is that I get to do those quality improvements to make sure in my area that we always have a healthy mom and a healthy baby going home. Okay? So then, what else did I did after that? Then I became a manager. Then I went to a high-risk hospital to be a manager there too. And then eventually, I ended up doing so many things, reason why I'm here. Does anybody guess why I'm here today? Do you guys want to know a cool story? Well, does anybody here knows Father Huber? No, you guys don't know him? Okay. Well, he speaks Spanish, and he's one of the priests who is in charge of Renacer Foundation. And basically, I follow him on Instagram. Do you guys have Instagram? Some of you don't. Yeah, I know that's for older people, right? Is that what you guys are thinking? So I follow him on Instagram. I'm part of his community. And then I was coming here to Orlando for a nursing convention. And I said, oh my God, I want to know where that Father Hoover works. And then I want to be there. And then I ended up coming here on Tuesday. And then he said, what do you do for a living? Because we didn't know each other. And I told him about my career. And he's like, oh my God, can you do a presentation? So I basically got volunteered, right, to do the presentation. But I love to be here, and I love to share what nurses do. So I said, absolutely, I can do that. So I did this presentation like on Wednesday at 2 in the morning. And then I am here today sharing my nursing career. And that's how I ended up coming here, guys. But it's so fun to be here, know what you guys do, know about the program. And then moving forward to my career, I've done mother baby, I have done labor and delivery. So fun things. We can go to the next slide. So even though that picture is not as clear, that is me in a Haiti medical mission trip. So as nurses, we can also do medical missions. So as a graduate nurse, meaning I had graduated but not passed my NCLEX, I was able to go to Haiti and take care of moms and babies. Isn't that fun? All right, we can go to the next one. We can go to the next one. Okay, so that was me making differences beyond the border. We provided basic health care to patients. We assisted the physicians and the other nurses because I was yet not a nurse. I was a graduate nurse, but I had not my license. We did some education. We supported mothers and babies. And then we worked with so many limited resources that it taught me so much about how it is to be in a third world country, even though I was born in one of them. And then I was able to get more cultural competence, teamwork, problem solving, and compassionate care. So it was a very fun trip for me. Team building with people I didn't know, and care for patients that really, really needed and deserved it. We can go to the next. Okay, so here becomes the question, what does OB nurses do? So I told you guys what obstetrics mean, right? Did I say that? Okay, so with that in mind, what do you think OB nurses do? OB meaning obstetric nurses. What do you guys think? What do? We take care of pregnant females, right? We take care of pregnant people. And we not only take care of them, but we do the delivery. And we also care for them after the delivery. Okay, we can go to the next. So OB nurses provide care during pregnancy, labor, delivery and postpartum. We monitor moms and babies. We provide and promote patient education, and we do something called patient advocacy. That is the most important thing of a nurse, to be able to do patient advocacy. Do you guys know what that means? What does that mean? Those who are shaking their heads. What does that mean? Advocate for patients, right? So when you're a patient and you're in bed, do you feel well? Do you feel like you can speak to people about yourself, how you're feeling, what you need? No, right? So that's what nurses do. As nurses, we not only provide the care, but we advocate for that patient, because you cannot do it for yourself, right? You cannot help yourself, so we have to help you. You don't know about medical, right? Like if anybody were to be pregnant here, do they know what to do? No. So as the nurses, we also advocate for you with the providers, because some physicians, we don't want to talk bad about the doctors, but sometimes the doctors want to make decisions based on their own judgment. And as the nurse, you're like, no, wait a minute. We're not doing that way. Let me hear from my patient, or I know my patient because I've been with my patient for so long. And my patient said that he or she prefers this, so we're not going to proceed. And that's what we do as nurses. We advocate, we care for patients, and we care for you based on who you are and in that connection that you have with your nurse. So not that I want anybody to be in the hospital, but if you ever are, please connect with your nurse. Tell them what you want. Tell them what's best for you, and I will almost guarantee you that they will make sure it happens that way, okay? We can go to next. Okay, so what are our responsibilities? We monitor maternal and fetal well-being. As I said, we put monitors on the mom and the baby, and we can see the baby's fetal heart strip, and that tells us how the baby's doing. And if the baby's not doing well, sometimes we have to do emergency C-sections. Okay, we administer medications, as you guys have seen, any nurse. We educate patients. The other biggest component of nursing after patient advocacy is patient education. Because if you start taking a new medication, do you know what it's for? Do you know how to take it? Does the doctor tell you how to do it? No, right? So the nurses, we do not only patient education, but if someone has a wound, if they go home with a device that they don't know how to use, we do all that education. And then we recognize emergencies, right? As I said, if I see that my baby's not doing well on the monitor, guess who I call? I call the doctor and I say, we have to go because we have to save this baby, okay? Or this mom. And then we collaborate with physicians and healthcare teams. There's so many people in the healthcare team, not just the nurse. We need the respiratory therapist. We need people from all specialties, right? So I'm an OB nurse because I do labor and delivery and high-risk antepartum. But I also need the neo nurse, which is that neonatal, neonatal means the newborn, right? So we need that nurse to come and take care of that baby when the baby is born. So we need so many people in the team. We can never survive without our team. We can go to next. Okay, so what is a high-risk pregnancy? So somebody told me that they didn't know what that was. So a high-risk pregnancy is basically not a healthy pregnancy, right? If you either have a medical condition that would affect the pregnancy, or if you develop that during pregnancy. Hormones do so many things to us, right? I have some females in this room, and I'm sure that you guys know when we have our period, what are we? We're so emotional, we're angry, right? But hormones not only do that, they also can increase your high blood pressure. They can increase your sugar, and they can do so many other things. So along with high-risk pregnancy, you can have, along with the pregnancy, you can have high blood pressure. You can develop something called preeclampsia, which means that is a worsening blood pressure in the pregnancy, diabetes in pregnancy only, or someone who is already a diabetic. We can have multiple babies. We can have twins. You guys know what that is? We can have triplets. And we can have quads, okay? I've seen it all. Preterm labor, meaning that the mom goes into labor before its time, before their time. So we have to make sure that they don't have that baby early, because otherwise that baby needs to be in an incubator and go to the NICU. And then we have conditions like placenta previa, people bleed during the pregnancy. Then we have maternal health diseases and advanced maternal age, because yes, at 35, all females are considered advanced maternal age, meaning that they need more monitoring. So as I said, what's another thing that we talk about in life? The goal. So the goal for all OB nurses is to keep both mom and baby healthy and safe as possible, and to send them home together. And we can go to next. Okay, so now we're gonna do a blood pressure monitoring exercise. Since we're talking about high blood pressure, have you guys ever done it?
Yes.
Do you know how to do it? No. Okay, so we can practice. We have some electronic ones and we have some manuals. So who will be my volunteers?